Well, look, it's a real pleasure to be here, and it's wonderful to see you all here in person. And hello to everybody virtual. Very excited about the whole program. One of the privileges of my role is to have seen everybody's talks in advance. They're superb, and I really hope you have a fantastic few days. So my job is to introduce you to EDS Echo. We've been talking about the mountains we need to climb. Here are a few ladders, a few ropes, any other equipment that you might need. And then we'll talk about where we are on our research program. So EDS Echo, first of all, to introduce myself, I'm an associate professor in medicine, a rheumatologist by trade in London. I'm the chief medical officer and the director of research for the Ehlers-Danlos Society. And I lead the EDS Echo program here, which has been an absolute honor and privilege to do. And one of the things that strikes me about it more than anything else is I cannot think in my own career and talking to other colleagues from other parts of rheumatology, of any other way that I might have been able to network internationally with so many amazing people, by which I mean both our community patient members, our carers, as well as healthcare professionals. It's a huge, huge network, and everybody that comes to join us in Echo enjoys that opportunity. So I encourage everybody to look and see what we do, come and join us and come and become part of that family. Okay. So what is EDS Echo? So let's just work our way through this. So Lara was already explaining the situation that we all completely recognize, and the jingles are still coming, of the huge delays in diagnosis and then the huge delays in access to knowledgeable people who are able to support people with EDS and HSD through the care they need, through the social support they need, etc. We completely recognize this, and so we have been working for the last 5 years and will continue to work onwards going forwards with doctors from multiple disciplines that are relevant to the conditions that we look after, which you can imagine are many, nurses, therapists from across all of the different therapies, physiotherapy, occupational therapy, nutrition, you name it. We have colleagues who've joined us in the network and share their expertise, midwives, pharmacists, health and social care administrators. And we were also one of the first organizations to set up an ECHO program for members of the community. So we have several new programs that I'll be telling you about in a moment that are going to be deliberately supporting community members who wish to become advocates and carers who wish to learn more about supporting their loved ones. So if you have a look at this little graphic here, it explains what we understand about the situation and how we hope ECHO helps to support you. Step one is that we know that people need easier access to specialty care. Step two then is to recognize that there just simply aren't enough expert clinicians, expert therapists out there to be able to support that care. So this is where ECHO then steps in, and through a virtual program, we're able to utilize the expertise of clinicians, therapists all around the world to support other healthcare professionals, learn more about EDS and HSD, and understand how they can actually practice for themselves in their own local environment in a way that they feel more confident with, knowing that we're there in the background to support them. And then what you end up with is a much, much larger network of individuals who feel much more confident and knowledgeable to support you at a local level. So we now have more healthcare professionals than ever before providing specialty care. This jingle's come back, but this time it came back at the right time because we now have, and it's gone off. We now have more clinicians able to help. Yay! That could stop now, thank you, yes. I don't know what they do, you can't get the staff. Right, so some of the language that we use, because it can be a little bit confusing as to what we're talking about. So we have two particular arms to what we do. We have programs, drop-in sessions, and courses. And the idea here is, with the support of an amazing ECHO team at the Ehlers-Danlos Society, We run a series of different programs, and I'll list them out for you in a moment, where we have expert facilitators from around the world who absolutely know their stuff. We run programs that have different themes. Some of them are for adult clinicians, some of them are for pediatrics, some of them are for nutrition, some of them for allied health professionals, et cetera, et cetera. And each of those programs is made up of a number of sessions. And in those sessions, we talk about cases, we talk about complexity of whatever that particular theme is for that session. And we run a number of different programs like this, all different shapes and sizes depending on the need of the people that are working with us. The drop-in sessions are really good fun. So this is where people like Claire Francomano, who's in the audience, and I sit there as the facilitators, and then anybody who's been part of the Echo family can come along and they can bring a little vignette or a question or a case. And I can tell you, it can be absolutely anything. But the amazing thing is that because you've got such a huge number of people that are there with such a wealth of expertise between them all, that Claire, I can't think of a single case that has come our way, as esoteric as it might be, that we haven't been able to provide a considerable amount of support and advice to help that clinician take the care of their patient forward. And it's absolutely amazing to see. And I encourage all of our clinicians to join us in that. We run courses too. The other thing that we do is we run one-day summits where we have particular themes, and some of you may well have been to some of our summits, and I'll list out the ones that we have coming soon. The whole idea behind this is that we move knowledge and not people. So this is another way for us to increase access. And it's fundamentally important to us. We don't want people having to travel massive distances, both within their own state or across states or even across countries. We see this all the time, and we need to try and do more to provide a much more local or regional service for you. And it's all teach, all learn. The environment that we're in, and I think some of the clinicians that come in and join us are really not too sure, initially. I mean, they've got Claire Francomano in the room. I mean, she's super special. I'm a little bit below her, but she's a goddess, right? It's okay. It doesn't matter if it's your first soiree into the conversation and you've seen 2 or 3 patients. What you want to learn and what you can bring are just as equal and just as valuable. All teach, all learn. And we're celebrating our 5th birthday. Hooray! When I kicked this off in 2018 with Claire, we had absolutely no idea what this would look like, and we're absolutely thrilled to bits as to where it is, and worried about the amount of expectation that there is now on us to make it look even more superb. But we'll get there. Okay, I've just been told I've got 2 minutes because I talk too much. Right, 2,100 participants so far. This is incredible. This is the network of people that I didn't know before. And I've listed out the programs that we run. So there's something for everyone from a healthcare professional perspective. And last year, we got funding to introduce a student program. So we have, at the moment, 20 students from around the healthcare professions that are all spending time with us, learning with us, and having mentorship from some of our experts around the world, which is wonderful. And we want to build that out year on year to really increase the amount of knowledge amongst our students. And these are the countries that we have participants from, scattered all over the world, as you'll see. And the little badges that you can see are our hubs. We have one in Canada, one in the United States, one in Mexico, one in UK for Europe, because we are still in Europe. And that was a Brexit joke. And one in Australia and one in New Zealand. And I'm wearing one of those badges now, and I'm going to plug it now because you can buy them at our desk. You're welcome. Right, this is what we've done. 760 sessions, over 1,100 hours of learning. We've had 690 specialist lectures over this time, delivered by 110 experts from around the world. This is really rich. This huge opportunity for clinicians who wouldn't otherwise get the chance to spend time talking about their cases with experts in the field. 520 case studies, that's 520 patients whose stories have been worked through in a multidisciplinary way to try and support their care. And last year, at Project Echo, we were recognised for all of our work by being awarded a prize for our work. We were one of the Excellence Award winners in 2023. We know from our research that this process increases our colleagues' knowledge, their clinical reasoning, their confidence in diagnosis and treatment, empathy, more empathic, greater understanding, team working goes up, networking goes up massively, and so does access to care. And we published on this twice with our cohorts to demonstrate the value of the programs. Looking forward, because I've been told to wrap up, in 2025, 26 and beyond, we're going to continue all of these different programs that are already really successful. More and more people are coming to join us, and they're all welcome. But we are going to introduce 2 new community programs. I promised one of these back in Ghent some time ago. It is happening, and straight after the GLC, you'll see an advert go out for our health advocacy program for members of our community who wish to become involved, and a caregivers program which will be starting next year. But beyond that, we have a whole strategic program where we want to get to those clinicians that are probably right at the forefront in the community, where you're most likely to meet a clinician for the very first time. Not us sitting in our towers in our specialist clinics, but your general practitioners, your emergency care or ER doctors, first responders or paramedics, dentistry and social workers. We're calling this our Back to Basics program, and we're going to build out bespoke teaching programs for our colleagues so that they can help each other to learn more about EDS and HSD. These are our 3 summits that you'll see being advertised, diet and nutrition in Q4 this year. Then next year we have women's health and another one on allied therapies, so look out for those. I'd like you to spend some time over at the desk and say hi to Paul and Kellen. They're outside at the front. Paul and Kellen are the people that make the whole thing work. Nothing works without them, and they are a true machine, and we're truly grateful to both of them. That's me wrapped up. I want to say thank you to all of those who have supported us. I want to welcome all of those who wish to join us, and thank you for listening.